shoulder pain, and it can come from different areas of the joints here, but one of the most commonest is people getting pain or complaining of pain right in through here and around this area here, especially if it's been going on for a long period of time. If they're finding they're reaching arms above the side, they're feeling pain stuck in here and they can't get above their head here, it's what we call a painful arc. Or when they're lying in bed at night, they have pain in the shoulder here and they wake up in the morning with lots of pain and it won't go away. Now, one of the commonest reasons why this is, when people ask this question, what is it? It tends to be what we call a shoulder impingement. And this is one of the most common problems you tend to get in the shoulder. Now, shoulder impingement is basically where a muscle gets caught in the joint as you move it. So in the shoulder here, you have these 4 muscles, which will act as rotator cuff muscles to help draw the shoulder down in and stabilize the muscle. Stabilize the shoulder, and then you have all the other muscles around here to help with it. And the supraspinatus is one of the main common muscles attached to the top of the shoulder blade here. It runs down through underneath the acromion process into the top of the shoulder here. So it's very common for that to get caught. So if you experience a lot of shoulder pain, a lot of it can come on, first of all, from having a poor posture and reaching over like this, which is what I've gone to talk about in other videos before. So if you want to help yourself, the first thing to do with helping any shoulder problem is to work on bringing the shoulder girdle back. Yeah, keep your shoulders back rather than being like this, especially doing weight training and things like that. So if you're doing lateral raises or anything, the first thing you want to do is you want to think about bringing the shoulder back, because if it's pulled forward, it's going to be more prone to getting caught underneath the joint rather than sitting back. Also, things you can do to help with that, as well as keeping the shoulders back as much as you can do, is work on stretching around the muscle and stretching around the joints here, but also try to avoid reaching above your head into cupboards, or reaching like cleaning the curtains or anything like that. And if you have to reach into anything, stand on a chair and reach in front of you rather than reaching above you. It may sound a bit silly, but if you're having a bit of pain and irritation and you think, oh, it's okay today, it's fine, you keep doing all these aggravating movements, it's going to keep causing a problem all the time, and that's what causes a constant inflammation. So anything you can do to help release that off. And then when you're actually treating it properly with some therapy, you need to have a lot of massage therapy, sports therapy, massage work to really help with that. But at home, you can use a tennis ball or anything, you can do massage work to help release tension off through here. But with treating any shoulder problem impingement, the first thing to do is get the shoulder girdle back, sitting back to here, working and release muscle tension through here, and also working on areas of the neck here as well, because when you have nerve irritation in the neck here, it goes hand in hand with the shoulder impingement as well, and also into elbow pain also. So getting all this corrected also longer term can really help it. But for now, in the meantime, anything you can do to help relieve any tension through here on mobilization exercises, moving the arm and keeping the shoulder back down and in, can be really helpful.